we're in agreement that we need to do and tackle the social care crisis. I think that absolutely.
So why didn't you?
I think that is a responsibility of governments of all shades. I think there has been
You had 14 years, you had several goes at it. So why didn't you?
There has been no mention of extra funding today, despite the fact the report saying that there is a massive capital backlog.
It's firmly saying everything's terrible and it's going to take ages to fix. And you need that to land with the British public so that in 4 years' time, when you haven't fixed everything, the British public won't say, well, maybe we should look at scrapping the NHS as it is. Hello and welcome to the Political Fourcast. This week, the state of the nation's health. A new damning report has laid bare the shocking state of the NHS. Crumbling buildings, outdated machines, and thousands of patients unnecessarily dying because of long waits in A&E, amongst other things. In response to Lord Darzi's report, the Prime Minister says the NHS must reform or die. But what will that reform actually look like? This is not the first critical report into the NHS. It's not even the first report by Lord Darzi. And Sir Keir Starmer is far from the first Prime Minister to promise reform. So why would it be any different this time? And what are they actually going to do? Joining me, two new MPs who have direct experience of working in the health service. The Labour MP Dr Allison Gardner, who worked with the NHS as a scientific advisor on artificial intelligence, and I should say academic doctor rather than medical doctor, and the Conservative MP Dr Neil Shastri-Hurst, who worked as a medical officer in the British Army and then as a surgeon in the NHS, but he's now left and become a barrister, and our own health and social care editor, Victoria Macdonald. And let's begin with you, Victoria. We've all got history of covering these reports and the NHS, and my initial reaction is, why did we need this? I could have written this. You could have written this. What has it told us that's new?
Well, Labour would say, and I think there is a degree of truth to this, that what they asked Lord Darzi to do was to bring together all the data. So he's very emphatic. This is evidence-based, that he hasn't put anything in there that he can't support, and put it all into one massive ream of pages. And it is looking at all the things that we know and have suspected, but now you have it right there on paper, that it is really in a shocking state.
Right, but how much of a hint have we got at what they're going to do?
Not a lot, I would say. So we had the Prime Minister saying that there needs to be reform, that it's going to be pretty much saying the biggest reform in the history of the NHS. Now, I am showing my age here, but I started under Ken Clarke as a health correspondent. So I have been through an awful lot of reforms, and I am a little bit cynical because we have seen some good reforms and we have seen some bad reforms, and then we have seen some reforms that really just fell by the wayside. And we haven't got enough detail yet on what they're going to do. They're talking about going from analog to digital. Well, that's great. That's not exactly a reform. It also requires some money. They're talking about moving money away from the hospital into the community. Almost every reform I've covered has said that. And it's about more prevention, which is an excellent idea, but again, never quite happens and hasn't happened in the past.
And financially, they are saying, basically, there's no more money.
Specifically saying no money without reform. But there has been no mention of extra funding today, despite the fact the report saying that there is a massive capital backlog. And we've just been at St Mary's Hospital in London, a major teaching hospital. The walls are crumbling, there's water that comes through the ceiling, the corridors aren't fit for purpose. They need that money now, the capital funding. We know you can't log on to a computer in the NHS. It can take up to, 25 minutes, half an hour. If they want new scanners, all of that's going to require more money. But there was very, very deliberate today that they were not going to discuss that.
Okay, well, let's get first reactions then. Neil, we all know what a terrible state the NHS is in. I presume you don't disagree with the basic description of everything that's going wrong.
But there are huge challenges in the NHS. I think we all know that. That's pretty clear to be seen. But I do think there are some issues around the report itself. It does feel as though it's been done at haste. completed over about a 9-week period. It's 162 pages in length, only 5 pages of which are dealing with COVID, for example. And of course, Lord Darzi has links with the Labour Party. He was a Labour minister previously. It's only in recent years he's left the party. I wonder whether a more expansive and a greater panel of experts would have been beneficial given the importance of this piece of work.
Alison, I mean, this is essentially a piece of politics, isn't it? This is the political argument and justification for where everything is in the NHS and trying to tell people there aren't any quick fixes, it's going to take a long time, it's going to be a long process of reform, and we haven't even mentioned social care.
No, I mean, I will say that wasn't Lord Darzi worked with the Conservative government as well?
Well, he was a health minister under Labour, and he's worked with Conservatives.
And it is an independent report. So, and it's been he was very strong on saying that one, and he absolutely, in his remit, he had a brief where he wasn't allowed to put forward any policy. So, his report is independent and it's not political, and it does outline in stark detail, evidence-based, from the people ground up, the people who matter, the patients, the frontline workers,
but why did
their
we need
experience.
Is the basic. We all know the NHS is a mess. We all use it. We all know people who use it. We know it is breaking down. NHS satisfaction levels are historically low. Why did we need a report that tells us what a mess it is?
Because it needed the proof. One thing I think it did say, and you're talking about sort of no money, is it did talk about the overemphasis on actual putting money into hospitals and into the diagnose and treat end of the care pathway. And it has made a very strong case for refocusing that on to prevention, which I think nobody disagrees with, and also within the community as well, where in actual fact, although more money's been put into the NHS, it's actually been primary care has actually lost an awful lot of its money, and that's where we've lost an awful lot of staff.
Victoria, what is the process now? When are the government going to start telling us what they're going to do, how they're going to fix it?
Well, quite shortly they will start the process, we're told, and they will begin to put together their 10-year plan. Now, of course, that will have to be done in stages because there's the urgent stuff. And they've already talked about how they're going to have more operations so that they can start to try and clear the elective backlog. They will have to deal with the winter crisis that is coming, that we will see once again in A&E. So you've got all those. There's some of the capital problem, like the crumbling buildings, that will need to be dealt with urgently. And then there is the stuff that can be done more slowly. Prevention, for instance, is not something that you can do overnight, because that requires finding more school nurses, getting more district nurses, going into schools to make sure that you're teaching children about their own health. I mean, the Prime Minister talked today about the number of 6 to 10-year-olds who go into hospital to have their crumbling teeth removed. Things like that will take a while to embed. So it will be in stages, but we will be given a 10-year plan at some point. I must say, not the first 10-year plan that we will have covered, but another one. And I guess within the next few months, we will see the beginnings of it. But it is going to take a long time. Lord Darzi was asked how long did he think. He said, you can turn the NHS around. We've done it before. But he thought maybe 4 to 8 years. Probably not in this parliament.
And when they've done it before, it's worth saying, in the Blair era, it was with a massive increase in investment. Tony Blair had to announce, that we were going to try and match European levels of funding, and they had to put up taxes and the health service budget as a result.
They described it as the most expensive lunch in political history, where he was persuaded to throw that money at the NHS.
Neil, how settled is this, do you think, within your party? Because, the great fear is, I suppose, for Labour, that you've got 4 years to try and turn things around. They're saying already, we're not going to solve it in 4 years, because they know that the numbers are still not going to be great. And what they fear is that your party, or possibly Nigel Farage's party, are going to start undermining the case for the NHS. Do you think that's possible within the Conservative Party?
I think the Conservative are very clear that we recognise the challenges that we face. Reform does need to happen. We had plans in place for that. I think the biggest concern, there have been no recommendations out of the report for the reasons Alison said. It was outside the terms of reference. But the government, there's a vacuum here from the government saying what they are going to do. The Prime Minister has suggested he won't get that 10-year plan until April next year. That's 9 months into his premiership, and we don't have a sense of direction.
But that argument was already going on, wasn't it, in the Conservative Party quietly? Well, this is a broken model. We need to look at different ways of funding health. We need to look at insurance. Do you think that's something that's going to start being allowed?
I think the key argument that's going to take place in the Conservative Party, and I think it's the right argument, is how we make the health service more productive. And yes, that part of that is putting investment of money in. Part of that is about getting human resources in terms of personnel there. But it's also about working more efficiently and more effectively. I think that is the most crucial and key argument that we need to be having. But of course, we can talk about capital investment. Labour Party have said they're not going to increase funding, but of course they've given a significant amount of the healthcare budget to junior doctors on a 22% pay increase. Now, there was no negotiation in that deal. They can say they've ended the strikes.
Do you think that was wrong?
I think it was wrong. I think it was wrong, and I think it's demonstrably wrong by the fact that the BMA have said we'll probably come back in a year's time. That needed a sensible grown-up negotiation, and just rolling over to get it off your in tray is not the right way.
Even though you were the people who were making the argument about the impact on productivity of the strikes.
Yes, but there was no negotiation with the BMA about having productivity reform as part of that pay deal. You have to make sure that you're getting something for that return. And the deal that was secured by the government was a poor deal, in my view.
Alison, how straightforward do you think this is politically? The public clearly have massive support for the NHS. They want it to work. But the political backdrop to that, that's why I say this report is so political, because it's firmly saying everything's terrible and it's going to take ages to fix. And you need that to land with the British public so that in 4 years' time, when you haven't fixed everything, the British public won't say, well, maybe we should look at scrapping the NHS as it is.
Well, the Tories and certainly Mr Farage would love that, because Jeremy Hunt and Mr Farage would love an American-based insurance system, and that's on record. So that, and you have the managed decline of the NHS over 14 years because that is your end goal. Yes, Labour want the NHS to remain free at the point of use for all our patients, all our people. That's its purpose, and that's what we will fight for. And arguments such as, the pay deal for the doctors, the cost of the strikes in financial, economic costs, but also within the damage to, the NHS and damage to, real damage to people's health, because they would not negotiate, they would not go to the table. So I think that's a little bit rich.
But as Neil says, they might be on strike again next year.
No, they don't go on strike again. Every year you talk about what that, year's pay increase is. It's an annual event. What's been happening for the last 14 years is that there's been pay depreciation, and you've been, pay rises have been a pittance and below the rate of inflation. So actually, in real terms, nurses and doctors' pay have fallen behind. But going back to your point, and you're quite right about productivity and getting the efficiencies in place. And again, the report was really damning about the 2012 Health and Social Care Act and about how that was done. And Darzi actually says, I can't quite quote the word, it was quite an amazing word he says, but devastating or traumatic thing that's been done, in compared to any health services across the world. It was actually devastating to the NHS, and we are still feeling, the outfall of that.
Well, let's play to both your expertise then. You've got an AI and sort of engineering background in that sense. How do you think that's going to improve productivity and make this switch from analog to digital real?
Oh, how long have you got? It depends on what you look at. So there's some fundamental things that you have to get right, so that information talks to each other, so that it's an easier workflow all the way through the system. Going on to sort of diagnostics, and we're talking about AI level scanners. That actually, again, increases the workflows. I visited the Royal Stoke in my constituency and in the radiology department, which was amazing. And they have something like 100,000 scans coming through and referrals that, and there's 4 radiologists there leading with them, and they're ploughing through them. So if you have AI-enabled decision making, so it's not automated, the AI doesn't do it and then makes a decision. It will give a recommendation. They will be that will be the second view. They're the first view. They will make a combined decision, and then that can go forward instead of a very much slower process of and error-prone process of just one, or maybe having to have a second radiologist to check on the things.
I think you're right. There is a role for AI in that to streamline the process. The same with pathological services in terms of interpreting slides. Those are the sort of innovations we do need to be seeing. It's precisely why the Conservatives put investment into that productivity plan in terms of developing the use of technology and AI in our healthcare service. That's a sensible use. But of course, a lot of that will require us to work with private industry. And we shouldn't be ashamed of doing that. And actually, I'll say I was heartened by Wes Streeting when he was in opposition talking about how we have to be open to doing that. It's not a gateway to privatising the NHS, but it's about using all the resources available to us in order to improve patient outcomes. That is a sensible approach to take. That's an approach the Conservative government was looking to take. It's one as opposition I think we should be supporting.
Okay, so let's park digital for a moment. I mean, as a surgeon in the NHS, what are the kinds of sort of management innovations and changes that you think need to be made?
There's a huge amount of bureaucracy in the NHS. We all hear about it, but the number of forms you have to fill in for one test, for example, or the transfer, and I'll pick up on Alison's point, of information from one clinician to another. You'll get lots of GPs pulling out their hair that they get a letter from a clinic asking them to refer them to another doctor in the same hospital. Well, why aren't we doing that in a streamlined process? So there are efficiencies that can be made that will streamline that process.
I did go and I did my local trust, and I did ask the question to the chief executive. There was one golden thing to fix the NHS. What would it be? And she said, fix social care. Fix the flow out, into that, and get the care in the community correct. That's probably not a good phrase to use, but the community needs to fix that. So Wes has been talking about the National Care Service and getting better mental health support.
You talk about the National Care Service as if it's a thing. It's not even a thing. It's just a phrase.
So was the NHS back in the 1940s when it was a concept.
Yeah, but there is no concept for a National Care Service
Not
either.
yet.
I mean, you asked the Prime Minister about this, didn't you?
I did this morning because it is. I feel exactly the same as you, and having looked at the NHS for a long time, almost every story I do on the winter crisis or whatever is because there is not enough social care, and people get stuck in beds and there is no flow through the hospital. And I did say to the Prime Minister, it's all very well giving us this report, and it's all very well talking about reforms, but you are not talking about the reform of social care, and we don't know whether there's going to be a royal commission. I mean, he is talking about getting cross-party consensus, which was tried under Theresa May's government and didn't work, fell apart for some reason. It's rumbling in the background, but it should be right up there, right beside the discussion on the reforms for the health service. It should be.
I mean, what possible justification would there be for a royal commission in social care when we've had one?
Everyone
has said what needs to happen.
I can't answer that question because I don't know what the justification would be. I think we had the last Labour government did an excellent royal commission. Then David Cameron had another look at it. I mean, when you talk to all the people who are involved in that, they're in despair because nothing came out of it.
But the point ultimately of a royal commission, which is basically just a long, big investigation, kick it into the long grass, write a report, try and get some sort of cross-party consensus, is all of you signing up to some very controversial and probably costly reform that leads to real meaningful changes in social care. I mean, do you think that is feasible? Can you see the Conservative Party saying, yeah, we do all just need to
They can't
agree
even
on
agree
this.
with themselves. Sorry.
No, I think the Conservative Party genuinely believe, I think we're in agreement that we need to do and tackle the social care crisis. I think absolutely.
So why didn't you?
I think that is a responsibility of governments of all shades. I think there has been
You had 14 years, you had several goes at it. So why didn't you?
Well, the same could be.
I don't want to be combative.
No, but the same could be
why
levelled at
not?
Labour. What we need to recognise.
We left it in a really good state in 2009.
What we need to recognise is that there is a responsibility on all politicians to try and find a workable solution to this. And if the Labour Party come up with good solutions, you're not going to hear criticism from me. You will hear me saying, right, that's good. How can we make it better? That is our responsibility.
I mean, it would involve cost, wouldn't it? I mean, that's where Theresa May came unstuck.
It will involve costs, and it will involve compromise. But
the Conservative Party would effectively have to sign up to a tax rise in order to pay for it. Some way, it might be inheritance, or it might, there's going to be some way that this has to be paid for.
There is always compromise that takes place. We have to look at what the proposals are, don't we?
Yeah.
But I think we should all be open to that because it is such an important issue. And without getting that sorted, we are always going to have issues with the National Health Service. And as I say, it's a responsibility of all of us. We were sent here by our constituents. I think they would expect us on key issues like this to work collaboratively where we can, but of course, oppose where it's a bad decision, but work constructively when able to.
Do you think, Alison, social care is something that you would expect to see tackled in this Parliament? Or is Labour sort of lining this up for its second term?
I don't want to see any more false economies where we do the sticking plaster politics that we've experienced in the 14 years, just to show that we can get a quick result, quick win, but it's false economy and it actually doesn't create the systemic change that we need. So that's what I'm hoping for. And with social care as well, again, I refer back to it, when they were trying to reduce the number of beds and centralise into these hospitals and shut down the community hospitals in North Staffordshire, where we had fantastic rehabilitation wards. We had fantastic wards for dementia care with highly experienced and specialised nursing. And they were wanting to shut those down, sell off that property, and then put those patients into private care homes, many of them failing their CQC reports and stuff. And then we were in this ping-pong situation of them going in and out of hospital all the time and then to carers. We have talked about the National Care Service several times, and we are stressing on preventative care. So this is what I'm hoping for. So
just finally, I mean, give us a sense of, suppose people say, okay, we get that it's a long-term project, we'll give you 2 terms. What is the NHS of 10 years' time that you think is achievable? Just paint me a picture of it. Is it basically saying we'll go back to where we were in 2009? Because that in itself is a huge task. Or is it something different? In 4 years' time, I would like to see digital transformation well on its way. With the federated data platform, well established, the, proper interoperability there. In my case, clear governance systems in place for any AI models that are being used, and then some improvements within the social care. And I would like to see some movements like that. You say it's just a concept at the moment. Well, we've been saying it. I would like to see that starting to be mapped out because we will need to sell that to the population in 4 years' time, aren't we?
Okay.
So there's a future here.
So you're happy to stop at 4. Give us a longer term view, Neil, of what do you think is possible? What's the best kind of NHS Britain could hope for?
Well, I think our aim has to be having a productive, efficient system that is forward-looking, using innovation and technology to improve patient outcomes. So there is never an end point to this because it's always an evolving picture, and we need to be harnessing those new technologies so that we're delivering better patient care. The NHS has changed massively since 1948. It was set up as an acute care system. Well, we're now dealing with huge amounts of chronic care in this country, and that is where we need more community diagnostic centres. It means that making sure that GPs are not just gatekeepers, but they're tackling those chronic health problems. And that feeds into the preventative healthcare measure that we want to be stopping these diseases starting in the first place. So I think there's a massive public health issue here, an agenda that needs to be tackled. But that will all lead to a more efficient service down the end. And of course, at the far end, there's the social care element. So it's a big project, and anybody who says they've got a silver bullet for it isn't being honest with the public. But it's also incumbent, and I said it a little earlier on us all to work as constructively as possible to deliver it. And I'm afraid I don't think this report helps us achieve that.
And just finally on this, I mean, you talk about doing a lot more at the front end and within the community. I mean, Darzi famously wanted to bring in polyclinics, which were sort of big primary care centres that would do a lot more than GP health centres do now. It was then killed off by the Conservatives. Is there time now? Is that what we need for precisely what you're talking about?
I'm not convinced by
the
polyclinics, but I think there are a variety of models that we see across the world that we should be looking at, and we should be stress testing those and seeing which fits our model of health service provision.
What is your model? When you keep talking about a model?
That's another podcast. We'll come back and do.
See, this is where we get a bit dodgy.
Conservative healthcare. Once they've worked out who their leader is.
Can I just say? Can we end on a little bit of agreement? That thank you for mentioning chronic health and those with multiple morbidities as well, because I will agree with him on that.
Victoria, just finally then, do you get a sense of what the government's ambition is yet? I mean, we don't have a plan. We'll get it something eventually, but are they daring to say what the aim is?
Well, I think all the way along, it's like any government, and I don't think that they would differ from the Conservatives under this, as they want people to get good and timely care. They don't want to see the A&Es overflowing. They don't want people hanging on the phone for their GP. They want a joined up system. I think where they could be more innovative, and there is a lot of discussion about this, which neither of you has mentioned, but is about it being cross-government, as in you do not make a decision about health without talking to housing, without talking to the Home Office, without talking to every single other government department. And so there has been a lot of discussion, and I think this is where it could be quite exciting, where you embed it into every part of government, that whatever you do, you have to ask, what is the impact on the health of the nation going to be, whether it's building better houses, whether it's building better schools or giving free school meals. And that's where the innovation can come that hasn't happened so far.
It is mentioned in the report, though. He does touch on it, doesn't Darzi? Yeah.
Let's see where we get with the next iteration. Thank you all very much indeed for joining us. That was this week's Political Forecast. Until next time, bye-bye.